of other people and not really jumping over others jumping over other people while they're talking. But feel free to jump in and talk when there is a gap in information. But if you do have something you want to contribute, feel free to use that reaction that's in that right-hand corner to be able to then put your hand up or thumbs up, and then I'll try to get you back into that conversation. Also, keep in mind to try to keep yourself muted so that there's less background noise going on during the conversation. There is an option if everyone isn't Zoom experts already to be able to change in the right-hand corner where it says grid view to select that, and you can see everyone in the conversation so we can all be one community at the same time. And then there's also available for the chat function at the bottom if you want to engage in a conversation there, or if you just want to read some of the feedback from some of the other participants. I am going to, now I want to introduce our guest on today's coffee break. It's Dr. Ekenga. She teaches a course in the Masters of Public Health program at the Brown School of Washington University in St. Louis. Her current work includes examining how lifestyles, environmental, and occupational factors interact to influence health and well-being. So definitely welcome, Christine Ekenga, and we're excited to have you here. We're also, Lisa Flegel is here, and she is going to help provide some different questions along the way. So you might see or hear her chime in from time to time. So let's just get started. Thanks, Christine.
Okay, well, thank you for the invitation. I'm happy to be here. I am on the faculty at the Brown School of WashU, and I'm an epidemiologist, and I study environmental risk factors for chronic diseases. And so a lot of my research focuses mostly on the physical and the chemical environmental factors, but I'm happy to be here and talk about the built environment. And as you see, everything, all these environmental factors are interrelated. And so I guess I'll start by just, and so as I go through the talk, feel free just to shout out and if you have any questions, and so this can be an interactive discussion. But at first, I just wanted to define, the built environment. So the built environment it includes all the human-made physical spaces where we live, work, and play. So this includes buildings, furnishings, open and public spaces, roads, utilities, and other infrastructures. And so when you're thinking about the relationship between the built environment and health, in general, research shows that there are features of the built environment that can result in an increase in chronic health problems, especially problems that are tied to obesity, lack of exercise, poor nutrition, and pollutants. So the built environment, it can have an effect on both physical and mental health outcomes. And I'll get into some examples as we go on. But there are factors in the built environment that can impact health at the community level, at the individual level, and even at the family level. And for the purposes of this talk, I'll focus on community level factors. And so in the research, there are generally like 7 factors in the built environment that are associated with environmental justice and health. And so these 7 factors, the first is transportation, second is access to food, access to healthcare, access to housing, access to air and water quality, psychosocial factors, and segregation. And so I'll spend the rest of the talk just going through these factors and give you guys examples of how they're related to just both environmental justice and health. So the first factor I mentioned was transportation. And if you think about it, you know, we're in a car-dependent society, and here in St. Louis especially, and car-dependent societies, they have implications for our health. They include, you know, an increase in traffic-related pollution and noise and congestion. And, you know, when you have a car culture, that results in reduced opportunities for walking and other forms of active transportation. And what we've seen in the research is that people who live in these type of areas, these areas that are marked by sprawl, they tend to be less physically active, they tend to weigh more, they're more likely to be obese and be more likely to suffer from chronic health conditions such as high blood pressure. So what we believe is that if we could think about altering some of the way we transport, some of the transportation systems, focusing more on clean community transport and focusing on improving walkability, we think that we can have some significant public health benefits, particularly in low-income and minority communities that may suffer some disproportionate impacts due to traffic-related pollution or poor transportation options. So that's the first factor, transportation, if we're thinking about the built environment. The second factor I mentioned was food access, access to healthy food. And this is an environmental justice issue because the research has documented that many disadvantaged, vulnerable communities, low-income communities, minority communities, they have limited access to supermarkets with fresh food, which contributes to disparities in health. There's been research out there that shows that if there is available nutritious food, the availability of this food can influence behavior change, can influence healthy behaviors, and there's a link between access to healthy food and risky and healthy behaviors and health outcomes. So being in a neighborhood where you have access to fresh food, access to healthy food, that's a built environmental factor, and it can also be considered an environmental justice issue. Our third factor I mentioned was healthcare access. And again, similar to food access, you're thinking about availability to healthcare providers. You want to have access to low care providers. You may not have adequate transportation to get to a low care provider. You may want to be able to get to a provider that is culturally competent. And just thinking about the St. Louis area, you know, I do a lot of work with cancer populations, and also I do a lot of care with a lot of organizations that are dealing with maternal and child morbidity and mortality. One of the issues that we have seen is that we're dealing with women who have to take 2 or 3 buses to get to their healthcare provider. You know, a couple of transfers, get on the Metrolink. And so, you know, this goes back to our first issue, which is transportation. We don't really think about healthcare access as a built environment issue, but it's a transportation issue as well. And this is an issue that we believe is an environmental justice issue as well. Fourth issue I mentioned, fourth factor, is housing access. And this is an environmental justice issue because for communities with low socioeconomic status, minority communities, if you have these inequities in construction, inequities in maintenance of low-income housing, this results in poor quality housing, overcrowding, health problems. And these poor and inadequate housing conditions, they can lead to anxiety, depression, aggressive behaviors, and chronic health conditions such as asthma and heart disease. They can also lead to exposures to chemical hazards, which I study, you know, air pollution, contaminants. So all of these factors can lead to adverse health outcomes. So that's an example of housing as a built environmental issue. That's also an environmental justice issue, which leads to adverse health outcomes. The fourth factor I mentioned, air and water quality. And this has been well documented also in my research as well. You know, communities of color, low-income communities, they are disproportionately affected by poor air quality. Also more likely to be exposed to abandoned properties that may contain hazardous waste. And some of the ways we can address this involving communities and public and planning, and involving these communities when addressing the concerns of some of the health problems that are experienced by these disparately affected communities. The fifth factor that I discovered in some of the work I've done here in the St. Louis community, and I can go into this a little bit more later, is, as I mentioned, these psychosocial and social cultural factors. So this built environment, and what I'm really referring to is crime and fear. So either real safety issues or perceived safety issues. And why I think this is a built environment issue and also an environmental justice issue is that these are issues that can hinder active hike lifestyles. So if people are afraid either because of real reasons or because of perceived reasons, they're more reluctant to go out and take a walk on a nice day. They're more reluctant to go out and jog, bicycle, or play in their neighborhoods because they don't feel safe. And as a result, this leads to physical inactivity. They're less likely to go out and go to the store and obtain healthy food or go shopping. And so, as you can imagine, this could lead to unhealthy behaviors and adverse health outcomes. So I think, you know, in thinking about the built environment, let's think about some of these psychosocial factors as well and their potential impact on unhealthy or healthy behaviors.
Do we want to open it up a little bit for some conversation too?
Yeah. If anyone has any questions, feel free.
Or any topics or any things that they would like to talk about, even not necessarily a question, but something to kind of build off of what Christine has just been talking to us about.
Sure. Christine, I'm interested to know what are some of the next steps we can take to create a more equitable built environment.
So some of the strategies I'm sure people on this call are really familiar with, but in terms of thinking about policy, thinking about developing mixed land use communities, in terms of planning our communities, thinking about developing more walkable neighborhoods, improving the availability of transportation options or even the variety of transportation options. And definitely fostering community and stakeholder collaboration in some of these decisions in our planning decisions. I think that those are the first steps. One of the factors I think that, yes, segregation is the last factor. And I think it's related to all of the factors I mentioned before. Thank you, Bob, for that question. It relates to transportation, food access, healthcare access, housing, air, water, and even those psychosocial factors. And low income and minority populations, they tend to be isolated. So they're isolated from affluent communities, are isolated from the job centers and business development, and they're more located near these highways and toxic sources. And so when you're isolated like this, then you're away from quality goods and services, you're away from supermarkets with high quality food. Your communities are saturated with liquor stores, dilapidated buildings, poor infrastructures, and that contributes to health disparities as well. The crime factors I mentioned. Depression, addiction. So exclusionary zoning, which leads to this segregation, which then leads to disproportionate exposures. Segregation is really a factor that, you know, is you can see it is related to all of these different factors that I mentioned before. So that is probably, yes, question, Nicole.
Hi, yes, I'm Nicole Adewale, and very pleased to meet you. Of course, I was attracted to the event by your last name. We'll talk offline later. But what I'm curious about, and I am a lifelong native of St. Louis, U City in particular, how do you combat segregation in planning without engendering gentrification, enabling gentrification. That's the word I was looking for. Because typically you blight an area, then you gentrify it, and those marginalized communities are just moved somewhere else or marginalized even more.
So before I answer that question, does anyone on the call want to contribute their thoughts?
I wanted to contribute. This is Angela Moore. I just think a lack of a community voice when I think that is one of the keys that causes gentrification is whether intentionally or unintentionally, the whole community voice is not heard. And usually one thing that I have learned is they place these community meetings when the majority of the community is at work. And so then their voice is excluded. And so there was just one factor that I've noticed with regentrification in St. Louis. And sometimes they're in spots that the whole community cannot have access to. And so they don't participate.
So there have been several recommendations out that have, several organizations have put out there to protect against some of the adverse impacts of gentrification. One is to protect senior homeowners. I mentioned before, promote mixed housing, build middle income housing as well as in addition to protecting low income housing as well. Think about fair housing rules. And also think about property taxes to protect long-term residents. So often what happens is that, as you're, improving the property values of these communities, it ends up pushing out long-term residents. So what you could do is put policies in place that protect long-term homeowners, some of the senior homeowners, and some of those low and middle income homeowners, so that they're not pushed out of the community. But it's definitely a concern that as you promote these new developments, that you're going to push out some of the more low-income residents. Any more questions? Hannah?
Yes. How do you protect renters? Because I sometimes think they're the most vulnerable.
Anyone familiar with renting policy on the call? Linda may have a suggestion if she would unmute her mic.
Okay. Well, I'm not sure that we have much official rental policy control in the St. Louis area. I mean, there are cities that have, New York has rent control policies, has had forever, a long time. I'm just not aware of that. And I think there are two factors that we need to consider in this gentrification issue, and it's a valid issue. One is developers and policy that pertains to them, commercial developers who, it is going to be a broad brush, quick sweep of a particular geography, with the primary concern being the profit for the developer. And now I'm not against that. I mean, I'm a free market person, but you have that. And then you also have gentrification that occurs property by property by property. such as if you look at the history of Lafayette Square. That was not, you know, the initial restoration of those homes was not done by a developer. It was done by individual property owners who moved in, improved the properties. Some of them worked very hard on them, et cetera. But I think it's a complex issue. One is rent control or rental laws, you know, and programs. And then does the development come from the developer side, you know, the corporate developer side, or does it come from the individual? So it really gets pretty complex. I don't have a solution here. I'm just saying, you know, we need to dig into like specifics of it.
Yes. Emily in the chat shared with us that tenant unions and organizing might help protect renters as well.
Looks like Victoria wanted to say something.
Hi, I did. Thank you. Hi, everyone. My name is Victoria. Thank you so much for your presentation today. I really enjoyed it. So I think my question is kind of St. Louis specific, because it kind of seems like almost all the factors are really tied into transportation and segregation, kind of overall. And as we know, St. Louis City is very segregated. But I was just wondering, specifically for St. Louis, what were kind of some of the recommendations for improving the transportation? Because I went to school in Chicago, which is also a very segregated city. And of course, they have the L train that's very efficient, but even then, it doesn't go all the way into some of the lower income communities. So it's really hard for them to even get to the main city where all of the jobs are. So I was just interested in what those transportation options might look like for St. Louis.
I am aware that Metro is in some of the work that we've been doing, looking at some of the maternal morbidity. They are looking at improving some of the transportation options in North St. Louis City and County, reducing increasing the number of routes and the time between different routes. So I know they're looking at trying to increase the number of routes in North City. I think our you know, if we compare our rail system to other major cities, we know that there's a lot to be desired. So I think that's also an option as well. But I think that, you know, there's a lot to be desired in terms of public transportation in the St. Louis area, and I think thinking about our Metrolink system is an option as well.
Metrolink costs so much money and takes so very long to build. Buses, I mean, you have to look at the bus routes, where they go, the timing. Bus routes get people back and forth really easily, and it doesn't take much to change the routes. Yeah. It might take community participation.
Well, I have learned that changing a route does involve a lot of planning, and it's a little more complicated than it looks like on the surface. But they are aware of it, and I think it's good to reassuring to know that they are working with some of the health systems and the community advocates to think about how we can address this problem. There are also the private sector. Uber Health is a new service that has emerged in the past year, and I know some of the organizations have thought about partnering with them in terms of delivering rides to their patients. With this pandemic, you know, it's been a little bit more difficult in terms of you know, starting the service, but you know, we are thinking about options. We know that transportation is a major issue in terms of being able to deliver high quality service to residents in the area, particularly residents in North St. Louis City and County.
Rhonda brings up some good points about various different, like for buses and high quality bus rapid transit. I'm curious as to what is the difference between regular buses and high quality bus rapid transit. I don't know if Rhonda can speak to that.
I can take a stab at it. So, hi, I'm Rhonda Smythe. I actually work with a multi-sector coalition of folks, including transit and the St. Louis City Health Department, under the umbrella of the Community Health Improvement Plan shared by St. Louis City and St. Louis County. So we talk about these things all the time. So high-speed rail would be like more like the Metrolink that we have now, but it would be that north-south version. There's been a lot of planning and advocacy that's been going on around that for a lot of years. It would cost $2 billion, and with our population continually decreasing, a lot of us just don't think it's realistic. High quality bus rapid transit would, like, we've never seen it here. So it's different than regular bus routes in that it has its own lane, and that you can actually have it so it pulls up to platforms like it would a Metrolink platform. So people just get on and off really efficiently. There's multiple doors to get in and out. And it would be a lot more doable for St. Louis, especially where we're at with our budgets continually. So there's a movement around that. I'll put my email address in there. If anybody wants more information, I'd be happy to roll you into the group that I work with.
Awesome. I think I saw Bob. His hand was up. I don't know if you want to jump in, and we'll probably wrap it up pretty soon.
Yeah, thanks. On these environmental justice issues, wondering, number one, are white people needed to help mitigate this? And if so, does segregation impact white people's ability to have capacity to deal with environmental justice issues in a way that could move these issues into solutions?
I'm not sure what your question is. Is segregation limit white people's ability to have an impact? Is that what you're asking?
Yeah, so like if I take a look at segregated life, and I live in a nice little comfortable house, and and I'm not even associated with any of the problems that are in the inner city or anything like that. I can live my whole life and be happy, and my egress, I'm totally safe. And I can't really have, that could interfere with my ability to have empathy and or feel like I need to be uncomfortable to address some of these issues, or like they need to be addressed, or that I'm even aware that these are issues that need to get addressed, which is what I'm kind of sensing, over multiple years of having lived in St. Louis, that there's just a big blind spot to all these environmental factors, and that people don't care, and they're just going to continue to live their life, out in West County. And I'm wondering if there's I don't know, any research or anything that's talking about the psychosocial impacts of, living that kind of life, and how that interferes with your ability to be in community and support those that are in need without just like being white saviorism.
I think there are many ways that white people can support the environmental justice movement. The first, I think, having a call like this is a first step, education. And I think that by participating in this call and being able to share what you've learned with others, that's an important first step. I can share my contact information after this call, and we can discuss. I can share with you some of the research of other ways that we can, that white allies and other allies can participate in the environmental justice movement.
Oh, thanks.
I think we are running out of time, but I did want to encourage everyone to vote on the election in August. Medicaid expansion is on the ballot, and I also wanted to thank you all at the U.S. Green Building Council for having me as a speaker. And
yeah, thank you, Christine, for joining us today. Definitely everyone look out for additional programming that we have out there. If you're not a member, I would encourage you to become a member of our chapter. We have various different levels in order to join. And then stay tuned for some more of our programs. Next week on Tuesday, we have our green building tour, which is of the Maryland Heights Community Center, which really should be kind of amazing how much detail they have put into walking you through virtually. The space is going to be awesome, and it's really designed about community, and there's going to be a big aspect of that. And so we hope to continue the conversation there. Thanks, everyone.
Thank you, everyone. There was, I see.
Are we still online? Feel free
We
to
are
send me
still.
Oh, okay. Send me an email. You can follow me at Twitter, and I look forward to connecting with all of you. Again, thanks for joining me on this call.
Thank you.
Thanks, everybody.
Thank you.